We are going to talk about the mandible. The mandible is the strongest and the largest bone of the face. It forms the skeleton of the lower jaw. The mandible articulates with the mandibular fossa of the temporal bone, forming a temporomandibular joint. The mandible is responsible for the grinding movements, mastication, and the phonation. The mandible has a body and a pair of rami. The body of the mandible has two surfaces and two borders: the outer surface, the inner surface, the superior border, and the inferior border. The superior border has alveolar processes for the teeth, while the inferior border gives attachment to the deep cervical fascia and the platysma at its whole length, and these two oval depressions called the digastric fossas. At the outer surface, just beneath the incisive teeth, are incisive fossas. The midline of the outer surface has a symphysis called the mental symphysis that joins the two halves of the mandible in the embryonic life, while it's fibrous in the early life. Just below the mental symphysis, there is a triangular protuberance called the mental protuberance. Just inferior lateral to this protuberance, there are tubercles called the mental tubercles. Just below the premolar teeth, there is a foramina called the mental foramen. It's bilateral. There is a line called the oblique line that runs below the molars and the premolars and joins the mental tubercles below. The inner surface of the mandible has four elevations called the genial tubercles. There are two superior genial tubercles and two inferior genial tubercles. There is a line called the mylohyoid line that extends below the molars, premolars, and extends tubercles below. Just inferior to the mylohyoid line, there is a groove called the submandibular fossa. Superior to the mylohyoid line, there is a groove called the sublingual fossa. The ramus has two surfaces and four borders: the coronite process and the condylar process. The lateral surface, the medial surface, the superior border, the anterior border, the posterior border, and the inferior border. The anterior border continues with the oblique line below. The inferior border forms the angle of the mandible below. The posterior border continues with the condylar process. The superior border forms a notch called the mandibular notch. The medial surface has a foramina called the mandibular foramen. The foramen continues as a mandibular canal and opens anteriorly into the mental foramen. Just anterior to the mandibular foramen, there is a tongue-shaped projection called the lingula. The lingula extends upward towards the coronite process. The coronite process. The coronite process is like a beak of the crow. It has two surfaces and two borders: the anterior border, the posterior border, the medial surface, and the lateral surface. The anterior border continues with the anterior border of the ramus, while the posterior border continues with the mandibular notch. The condylar process. The condylar process has a head and a neck. The head of the condylar process articulates with the temporal bone, forming the temporomandibular joint. The anterior to the neck, there is a groove called the pterygoid fovea.